Welcome back, Focus Learners. Today, we're diving straight into a pretty heavy but absolutely crucial topic for this explainer. We are unpacking the modern intimacy crisis, specifically how digital age sexual anxiety and physical dysfunction are just completely breaking down real-world relationships. And look, this isn't just about biology. It's really about how the digital world has totally rewired our expectations and our literal bodies, pulling us so far away from actual human connection. We're basing our deep dive today on the very real, very raw clinical realities shared by Dr. Vijayant Govinda Gupta. He's a certified urologist, and he sees the unedited truth of this exact crisis in his clinic every single day. To really grasp how high the stakes are here, we need to look at a raw case straight from Dr. Gupta's clinic. We're talking about a patient literally expressing suicidal thoughts because his marriage had just fundamentally collapsed over physical intimacy. Hearing that makes it painfully clear that we aren't just dealing with some minor medical inconvenience, right? This is a deeply emotional, life-altering epidemic. When intimacy fails, the entire foundation of a marriage can crack. It leads to profound distress, infidelity, and honestly, in a lot of cases, total relational collapse. The stakes are just incredibly high.
You know, it's actually fascinating how our vocabulary kind of exposes our whole mindset. Just think about the English word intercourse. It sounds incredibly mechanical, doesn't it? Almost like a transaction or a machine operating. It perfectly mirrors the artificial, totally solo-focused nature of modern adult films. Now contrast that with the Hindi concept of sambhog. Sam means together, and bhog means to enjoy or partake. So it literally translates to shared enjoyment, deep intimacy, and co-creation. The whole modern intimacy crisis is fundamentally just a massive shift away from that beautiful, shared connection of sambhog and a regression back toward a lonely, mechanical, and screen-driven idea of intercourse.
Which brings us to this glaring medical paradox. If we actually look at the clinical data, why are physically healthy young men, guys in their 20s and 30s with no diabetes, no heart conditions, perfect blood pressure, why are they suddenly failing to sustain an erection when it actually matters in the real world? The answer isn't hiding in their physical biology. The answer actually lies in their daily habits. It all points back to what we can officially call the masturbation trap. Now, we have to be super clear here and separate a natural, occasional, physical release from our modern reality. Because today, we live in this hypersexualized digital environment. With a smartphone in literally every pocket, young men are falling into a screen-induced daily addiction. And this daily habit, it actually rewires the brain's dopamine reward center and physically desensitizes the body. You are essentially training your body to only respond to a glowing screen and a solo grip, completely bypassing a real living, breathing partner. This intense solo habit creates two massive clinical roadblocks. First up is venogenic erectile dysfunction. Basically, what happens here is that the anatomy gets so used to the intense, tight grip of a hand that the veins literally fail to trap blood when introduced to the much softer, warmer environment of a real partner. The erection just completely drops. The second issue is premature ejaculation. The body has been trained for years to just race to the finish line in front of a screen. This results in completely untamed reflexes and extreme hypersensitivity. The clinical reality of this? Men are discharging in 15 to 30 seconds upon penetration. And hey, this perfectly tees us up to bust a massive internet myth. You've definitely heard the term post-nut clarity, right? The idea that excessive masturbation somehow clears your head and relieves all your stress. Well, Dr. Gupta's clinical perspective completely shatters that. It is actually post-nut confusion. It functions exactly like a massive sugar crash. Sure, you get this tiny temporary hit of relief, but then you immediately crash, you lose your focus, and your brain starts aggressively demanding another hit of dopamine. It doesn't bring you clarity at all. It just drives a vicious, isolating cycle of addiction that pulls you further away from real life. Okay, so if that's the destructive cycle for guys, we really need to flip the script for a second and ask, what about women? What actually triggers female arousal? Because the adult media that men are endlessly consuming programs them to believe that women are magically aroused by the exact same extreme, immediate visual triggers that guys are. But clinically, scientifically, and emotionally, that is just completely false.
Get a load of this clinical statistic. 80%. 80% of women do not orgasm from penetration alone. Let that sink in. If a man's entire physical training is based on rushing straight to penetration and finishing in 30 seconds, he is quite literally leaving his partner completely behind. So let's actually break down the real triggers for female arousal. Unlike the visual, instant gratification loop that men get stuck in, female pleasure requires a rock-solid foundation of emotional bonding and respect.
It literally requires time. We're talking pre-sex foreplay, kissing, hugging, truly building up that intimacy. Physically, it requires specific clitoral stimulation and rubbing. And when it comes down to the act itself, a woman typically needs a solid 8 to 10 minutes of sustained penetration to reach an orgasm. This just completely shatters the frantic, highly mechanical depictions we see in the digital world. Now, here's a clinical baseline that honestly might blow your mind a little bit. A healthy, physically fit male who is not suffering from screen-induced addiction should naturally be able to sustain an erection for 30 to 40 minutes. Yeah. Compare that healthy 40-minute baseline to the modern, tech-addicted average of just 30 to 90 seconds. It shows us exactly, with crystal clarity, how far our physical health has plummeted just because of these hidden daily habits. All right, let's get into the solution, the Erection Recovery Protocol, or ERP. Dr. Gupta uses a highly effective, totally non-judgmental clinical approach that consists of 4 concrete steps. First, you absolutely must step down your masturbation frequency to break that daily addiction loop. Second, you need to physically rebuild the damage. You do this by strengthening your pelvic floor using Kegel exercises and deep squats. Third, you've got to fix your sleep. Ban blue light screens from the bedroom entirely, like completely. This allows your testosterone and hormones to naturally recover overnight. And finally, you can add some simple supportive supplements like vitamin D and L-arginine. Stick to this, and within a few months, you can completely restore your stamina and hardness. Look, quitting any daily habit is rough, and going cold turkey, yeah, that almost always fails. That's exactly why the protocol includes a 30-day step-down strategy. First up, calendar tracking. Literally limit yourself to a specific number of allowed days and just slowly reduce them over the month. Second, remove the triggers entirely. No smartphone in bed after 9 p.m., period. Third, institute a habit breaker. The very second an urge hits, drop and do 10 squats. It physically redirects your blood flow and breaks the mental loop. And fourth, tag an accountability partner so you stay honest with yourself. Now, as guys start doing this work and trying to recover their intimacy, they almost always hit another massive wall of anxiety: physical size. So many patients walk into clinics asking if a quick surgery can just magically increase their size to 7 inches or more. So we have to ask, is this super common fantasy of extreme surgical enhancement actually rooted in reality? The incredibly short answer here is no, and we really need to completely destigmatize this size anxiety right now. Adult media uses a massive selection bias. They deliberately only cast actors who represent the top 1% of extreme human anatomy. What you're seeing on a screen is not a reflection of reality, folks. It's a carefully curated illusion designed specifically to look dramatic on a 2D camera. To take the pressure off immediately, let's just look at the actual, undeniable medical data. The average Indian penis size is 4 to 4.5 inches. That is the normal, completely healthy clinical average. If you fall in this range, you are totally normal. The anxiety you're feeling isn't because there is something wrong with your body. It's because there is something fundamentally wrong with the media you're consuming. So what is the deal with those enhancement surgeries then? Let's demystify this really quick. Penile lengthening surgery absolutely does not grow new tissue. It is simply a procedure that releases hidden internal ligaments to expose a maximum of maybe 10% to 20% more of the existing shaft that's tucked inside the body. Sure, it might give you a tiny fraction of an inch of extra visibility, but it is definitely not a magic wand that transforms your anatomy. Ultimately, clinical experts always come back to what they call the trifecta of good intimacy: good hardness, good timing, and good size. But here's the catch. Without hardness and timing, which are the exact 2 things that screen-induced addiction absolutely destroys, size is entirely useless. You cannot rely on size if your body has literally forgotten how to be present, hard, and lasting with a real human partner. So we've arrived at the big final question. This whole modern intimacy crisis really boils down to a choice between the screen and the real world. You've seen the data, you understand the heavy physical toll of the masturbation trap, and now you have the exact protocol to fix it. It is completely within your power to rebuild your physical health and reclaim your real-world relationships. The only question left is, are you ready to log off, beat the digital addiction, and do the real, genuinely rewarding work of human connection? Think deeply about what you're sacrificing for that cheap virtual validation. Thanks for joining me on this one, Focus Learners. Until next time, stay curious, and most importantly, stay connected to the real world.